You're tuned in to The Andrew Lawton Show.
Since we're keeping on a little bit of a provincial bent today, I wanted to turn from one area of provincial jurisdiction to another, which is healthcare. Not to say the provinces are always managing this issue as well as they need to be. This is probably no more acutely available and accessible to us than it is with wait times. Now, wait times are not as much an issue as they are. Or let me back up. We don't hear the discussion of it as much as we did a few years ago even. There was a real pinch point where there was a crisis, especially in Ontario, of people being treated in hallways. You had hospitals that had to develop hallway medicine protocols. But when we talk about access to healthcare, especially to surgeries, which are very much important for people, they're still in terrible, terrible places. We know there are a number of studies that have pointed to how many Canadians are just taking themselves off the wait list and going and paying out of pocket in the United States or elsewhere in the world. Our friends over at secondstreet.org have been tracking this issue relentlessly, and they found that wait lists have increased by 5%, with over 140,000 more Canadians waiting for surgery, diagnostic scans, or specialist appointments. Joining me is the president of secondstreet.org, Colin Craig. Colin, always a pleasure. Thanks for coming on today.
Well, thanks for the chat today, Andrew. I appreciate it.
So obviously, this is an issue that Canadians, if they don't know about, it's because they're fortunate enough to be not on the wait list. Any Canadian who's ever tried to navigate the system is well aware of this here. And we're not talking about examples of people that are, being turned away at emergency rooms because they had a heart attack and they're not being treated. But that is also not to say that these are not very crucial things that people in Canada are not able to readily access.
Well, that's right. I mean, these numbers that we've dug up, we asked every province in the country a pretty straightforward question. How many people in your province are waiting for surgery, a diagnostic scan, or to see a specialist? And there were actually only 3 provincial governments that could tell us all 3 of those numbers. Nova Scotia, Quebec, and Alberta. And the other provinces gave us either one of the numbers or 2 of the numbers. So there's a lot of holes in it. We're looking at 3.1 million people waiting for those important healthcare services. And you alluded to it, in many cases, sadly, those are a lot of people that are suffering. And we tried to be cautious and try to fill in some of those blanks. If you go to our website, you can see we've got this big grid with all the numbers the governments gave us with a lot of holes. And if you fill in the holes to try to look at what that big picture looks like, it's probably about 5.1 million Canadians that are waiting. Or to put this in plain English, about 1 in 8 Canadians are on a wait list right now for healthcare services.
Just to jump on that point, the issues that you had from the provincial governments, is that a data collection issue or is it a transparency issue? And by that, I mean, do they have the numbers and they're not sharing them, or are they just not making it a point of finding this data?
I think it's partially a data collection problem and, to be blunt, an incompetence problem. If you have a problem, the first thing you need to do is understand how big it is and understand how you're going to get rid of it or attack it, fight it, whatever you want to call it. So if you're going to measure progress against how many people are waiting to see a specialist, well, the first thing you got to do is figure out, okay, well, how many people are waiting right now to see a specialist and how do we get that number down? And if you can't produce that number as a provincial government, I think that's a problem. So yeah, I think it's a problem in terms of the fact that they don't seem to collect the data centrally in some cases, and in other cases maybe they're just not even asking the question to find out.
Well, and to be more cynical on this, not that I try to be a cheery optimist sometimes, but why would you want to collect the data if you know what it will show? And I think that's probably where we're seeing a little bit of this here. There's no motivation to go in and do an intensive deep dive into figures that are going to show provinces are not delivering the service they're supposed to.
Yeah, no, that could be part of it. I mean, we've got to remember too that they can often give us some data, but not others. So they could tell us right across the country, pretty much, with the exception of Prince Edward Island, how many people are waiting for surgery. But we got to remember that quite often with healthcare issues, you don't always need surgery. Sometimes you need some kind of other intervention, medication, or some kind of other change, physiotherapy, whatever it is. There's often cases where you don't need surgery, and so you've got to meet with a specialist to find out what that course of action is. Maybe you need a diagnostic scan and so forth. So It's troubling that we can't get those numbers, but like I said, the numbers don't seem to be good. There were some bright spots, though. We saw some positive improvement over the past year, and Saskatchewan and Manitoba and Quebec were a couple of the ones that we highlighted where we've seen some good progress in terms of the number of people waiting.
I know that the third rail in Canadian politics has always been healthcare. I mean, any discussion about the system yields just this knee-jerk, visceral, emotional reaction from people. We've had mixed court rulings on, what you're able to do as far as, fee-based services and care. But one thing we know in the case of Quebec is that you have the option to oftentimes go and get a service out of your own pocket. Now, that's not to say that when you're paying as much in taxes as you are for provincial healthcare, that's just. But if you're kind of just looking in self-preservation mode, I get why people do that. So for people outside of Quebec, though, they don't have that opportunity available. So they're either forced to just deal with it or to leave the country, are they not?
Yeah, that's basically it. It's a real messy situation. It makes no sense whatsoever. So you're right. If you're living in Montreal and let's say you need to get your hip done, you have a few choices. One of which is you could wait for the government to provide you that hip operation and you get it done, you walk out, you don't face a bill, it's paid for through tax dollars. You also have the option of going to a local clinic in Montreal and get your hip done, or maybe in Quebec City or somewhere else. You can pay for that privately and get it done faster. You have that option, public system or private option. Then obviously you have a third option, which is to leave the province altogether, maybe go to another country or another province, whatever. So Quebec is unique. The Supreme Court of Canada has given Quebec this unique right. The rest of the country, you don't really have that option. There's a whole bunch of government regulations and barriers that mean that you can't pay, for example, in Vancouver to get your hip operation done. You have to travel somewhere else. So quite often you see people from Vancouver fly to Calgary. And you often see Calgarians do the same thing. They'll fly to Vancouver and pay for it. There's some interesting things that are happening there where in Calgary is actually a clinic that has been able, it's a bit wonky, but they've been able to hire surgeons that are not part of the public system whatsoever. And you can actually now pay in Calgary for some private surgery locally. It's weird. It doesn't make any sense. The problem is all these government regulations are gumming up the healthcare system. They're leading to more people depending on the public system rather than some of those people deciding to pay privately. And when that happens, you take pressure off of the public system and you reduce wait times of the public system. And that's why no other developed nation on the country with universal healthcare does what Canada does. They make it easy for patients to have that choice because it's better overall for results.
Yeah, and I want to talk about one of those ideas in a moment, but just on the weird sort of situation you described there in Alberta, one of the things I find so obnoxious about this debate is that we don't really have the system that the universal healthcare activists think we do and kind of pretend we do, where it's not this truly 100% public system with nothing private whatsoever, because there are these weird loopholes and exceptions. I mean, on one end, you have just people that have a friend of a friend who's a doctor that can jump the line that way. But in other cases, you have a lot of clinics that operate in a very weird legal gray area. I've talked to some people. In fact, I did a discussion on this very show, and there was a private healthcare clinic in my city that does a combination of private and public healthcare. And I had a lawyer on the same show who was saying, well, I'm not convinced that what they're doing is legal. And the owner of the clinic said, well, yeah, we are. And here's why. But people can't even quite agree with what the law says in some cases on this stuff. And then you further add to this, patients just want a solution. Patients don't care where it comes from. And one of the points, your colleague, Dom Lusick, wrote an op-ed for True North about this. And he said in the European Union, you can go to another EU country, pay out of pocket, and then be reimbursed. Now, I'm never a big fan of government spending a lot of money, but my approach to this would be if the government has said that you had a right to this and they were going to pay for it anyway, it shouldn't matter where you got it from. But that is a no-go in Canada. Yeah,
you're right. I mean, it's sort of like taking the horse blinders off for governments, right? We have this approach in this nation largely where provincial governments think, okay, this is how we're going to provide healthcare to Canadians. And they're thinking within their own jurisdiction. Whereas what they do in the EU is they take the horse blinders off and they say, well, wait, we can allow patients access to the entirety of Europe and allow them, if they want to go to another European country, they can go there, pay for surgery, and then get reimbursed by their home government. And it's not whatever they want to spend. It's up to what that government would have spent locally. So if we give an example in Canada, let's say in Ontario there, Andrew, that you need your hip operation. And let's say that the government's going to tell you, well, they'll get to you next year. So in the meantime, you're in chronic pain, you're off work, you're not making any money, you're dependent on the social assistance, whatever. It's a bad situation all around. But if they said to you, Andrew, okay, if we give you this surgery next year and it's going to cost $30,000 for us as a government to give it to you, we're going to give you the option of going somewhere else and you'll have access to $30,000 in reimbursement. Well, you might decide, well, look, I've got a cousin in Lithuania. I'd love to see that cousin. I'm going to go over there, see that cousin, and at the same time, I'll get my hip operation because I can get it done for maybe 25,000 Canadian. And, I'll actually save the government some money. Well, you'd have that option. You could recover at your cousin's place, whatever, or maybe you go to Tennessee or wherever. You would have that option suddenly as a patient. You'd have access to thousands and thousands of places to get that surgery done around the world. And for the government, it's positive because they can get you back to work faster. You can start working again, paying taxes and so forth. They're paying the money, say, this year instead of next year. In that example of Lithuania, they'd actually save a bit of money. Maybe if you went to Tennessee, it was $30,000 or maybe $35,000. If it was $35,000, well, then you're paying that difference between the $30,000 and $35,000. But it's good for the government because it helps them get you the care you need faster. Like I say, you get back to work. For other patients who decide not to go abroad for surgery, well, they benefit too, because now Andrew Lawton's not ahead of me in line. He's gone off to somewhere else. I don't want to travel. I want to get my surgery in Ontario. Well, it's still good for me because now I get to move up a spot in line. So it's good for patients too. It's not a magical solution, but it can help in a time of crisis. We're in a time of crisis. So it's an idea that we think that governments should give a look at here in Canada. We've actually seen some governments kind of do this. In Manitoba, they've been sending patients all over the world to Ohio and California and British Columbia, and I believe Alberta as well, sending them to private facilities where they can get their hips and their knees done and whatever. That was one thing that they did to try and get their backlog down, and they've had some positive results in Manitoba. The numbers are down about 21% for the surgeries that they provided data for. So I think it's an option that could help.
Yeah, very well said. You can read all of this and more over at secondstreet.org. The president, Colin Craig, always good to talk to you, sir. Thanks for coming on today.
Thanks for having me, Andrew.
Thanks for listening to The Andrew Lawton Show. Support the program by donating to True North at www.tnc.news.